I think all of you guys know these amazing parents here, but we wanted you to really walk away from this session, as I mentioned, with suggestions for how you can get involved with the community to help us advance our mission. It doesn't matter how many resources you have, it doesn't matter where you live, there's going to be something that you can do to help us. Well, Lisa Pankong and I are likely the faces of this organization. We don't do this work alone. There are so many people behind the scenes that are helping us do what we do. I want to stress that we could have filled this stage with all of those people, but really we selected a few examples so that you could get a sense of how everyone is, a diversity of examples of how people are getting engaged in this ambitious vision. I think about others who are not in this room today who have helped us tirelessly. Shanna Tolbert stepped up to develop the vision of the Cure Club. She leads our hemiplegic migraine and DE group on a monthly basis. Toby Lundstedt, who constantly chimes in on Facebook when there's a newly diagnosed family. Have you checked out the foundation's website? Have you gotten involved? All of this is on their website. Erica, Laura, who attended professional conferences for us this year to raise awareness among professionals by standing at our booth, giving out brochures. Wes, who's not here anymore, he was at the phlebotomy session yesterday helping just Pankong make that happen. He's an uncle of a child affected by CACNA1A and lives locally, and he said, how can I help? He just showed up. My point is there are so many ways, big and small, to get involved. It doesn't have to be led by the foundation. We don't have to, manage you. We want you to be able to go home and take on a task. Do something that you feel is manageable. Wear your shirt. I mean, if that's all you can do, that's fine. Fill out a survey. We all can do something, and why we've assembled this group is each of them are doing something by just stepping up, and we are so grateful to each of you. So this is going to be kind of an informal conversation. We want it to be interactive. I'm just going to start by, if you could just briefly tell us about your family and your journey to the CACNA1A diagnosis. Sarah.
So I'm Sarah Greathouse. We live in southeastern New Mexico, and Clinton is my husband, and we have 6 kids. And Emery is our CACNA1A champion. She's our baby, diagnosed at 2.5, and she's 5.5 now.
I'm Deborah Ondrasik. Let's see, I live in Rhode Island. I have 3 children. My oldest is 10, Gabrielle, and she has epileptic encephalopathy. She was diagnosed at 22 months is when we got her diagnosis.
Hi, I'm Casey Dawley. My wife Sonia and I have a CACNA1A champion named Avery. He is currently 7 and was diagnosed at 2.5 years old. And
hi, I'm Senaratne. My wife Christine and I have a daughter Elise. She was diagnosed at 2.5 and she's now 5.
Okay, great. Let's just go down the line again and tell us a little bit about your skill set, your professional background, what you thought you could bring just from a skill set background to the foundation.
Well, right now I'm a stay-at-home mom, obviously. I have a nursing background, and for the most part, I have just recently found my passion, not being able to go back to work after Emery's diagnosis, to honestly just see what I can do and try to make an impact and see the ways that we can, I guess you could say, fill the void, so to speak. We live in a really small community. Sometimes it feels very not great, but in those same ways, it's like wearing the shirt and people are like, how do you say that? Or, why are you carrying oxygen around? Just little ways to speak up and have conversation. So that's been a little bit difficult for me living in a small town to be able to talk about it. Sometimes it's a little uncomfortable and I don't know always how to answer the questions, but just speaking up, being present, just being able to have that courage to, say, hey, she might be differently abled in certain areas, but we need help and we need support, and the word rare has actually become empowering, I feel like. So it's something that our kiddos are super unique, and so are our families, and we all have something really wonderful to bring to the organization. So.
Yeah. So I'm a general pediatrician, and I'll just share a little bit. This involves Sunitha's mom, who's here. And so I came here 2 years ago to San Antonio, to the conference. And when I came in, I had very little engagement with the foundation other than like constantly asking Lisa and Sunitha for questions related to my daughter, but like just like a taker, you know? And so I came in, and I actually at that time didn't even know her variant was A713T. Like I was very unknowledgeable. And at the time felt like I was just really stressed. I had little kids. One of them was really severe and felt like I had nothing to offer. I also always considered myself like just a general pediatrician. Like I'm not a neurologist. I'm not a specialist. I'm not a hospitalist. And Sunitha's mom, gosh, she just came right over to me and she said, "Are you involved in the AAP, American Academy of Pediatrics?" She's like, "You need to say something. You need to raise your voice." And like, to this day, I can't forget this like finger in my face. And I was like, okay. And so I just couldn't let it go. I just thought about it. And I was like, yeah, I guess I'm probably the only pediatrician mom in our group. I guess that is unique. And I just hadn't thought about it before. And so I don't ever like to do things alone. So I found some other rare pediatrician moms, and I started brainstorming with them. I said, "Can you just join me for a call and we'll just like talk through what we can think about?" And I realized we had a really shared experience where we felt as pediatricians that we were not being appropriately represented by the American Academy of Pediatrics. We really don't feel like they care for rare kiddos collectively, not just CACNA 1A. And so it's just become my passion to try to raise awareness among the pediatric community that kids with rare disease and rare symptoms need to have genetic testing, and that will help diagnose more CACNA 1A, but also will help all rare kiddos, but just really end that diagnostic odyssey. This year, Sunitha's mom, again, this is just highlighting maybe she doesn't feel like she can have much of an impact, but this is just the impact of words. She said, again, finger in the face, "You need to start with the NICU. It's the neonatologist." And I was like, yeah, you're right. Okay, I have a friend in Rhode Island who's a geneticist, neonatologist, Jill Marin, and talked to her once, and I'm gonna go home and talk to her again. Sorry if that's too long.
So my background, I retired from the military, and that gave me one awesome skill. When there's downtime, you ask, "What can I do?" And then you find one of those things that they say you can do, and you do it to the best of your ability. And when you finish that, you ask what you can do again. So as a dad who's retired and now has more time on his hands, I'm asking the foundation, I'm asking Lisa and Sunitha and Pang Kong, what can I do? And one of the things that we recently did a couple years ago was got involved with the 5K committee. So one of the things that has been mentioned one time is we've given out a little over $250,000 in grants. And those grants, it's been 8 grants, I believe, and those are around 50,000, some a little bit more. And those are usually seed grants. They get people's research started on things that are very important to our community. The things that the scientific committee and everybody picks out is very important. So when we do our fundraising, it's important to give that information back to the people who we're raising money from. So that's something that we find very important that we do as parents is take this research in the small little layman's terms that's on the website that says, here's the basics of the research, and giving that back to the people to say, when you give 5, 10, 20, however much money you're going to give in our fundraiser, this is what it goes toward, and it makes a big difference because your small donation toward a $50,000 grant is huge. And then that can also turn into these larger grants that are granted by like NIH. One of our early grants to Dr. Colcraft, that was like a $50,000 grant, he turned around and was able to progress that research and get a $5 million grant. So the $50,000 that our foundation gave him turned into $5 million, plus the machine and other things that help with that. So our small impact as parents and just saying yes and what can we do and trying to do this fundraising is huge. Another thing my wife asked me to do is tell people to chant natural history study to everybody. I'm not going to do that. She said it makes me look weird. And we know I don't like looking weird. So that's basically my thing is just say yes. Ask what you can do. If you have a breath, and some of us don't have that breath to be able to take and have that time, but when you have that breath, ask what you can do, and there's something small out there you can do, and try to progress these 3 pillars over here on the sign of progressing research, helping families, and I forgot what the third was.
Raising awareness.
Raising awareness, yes. And I will always wear a Cactus 1A shirt, except now I just wore a purple shirt sitting up here.
So my background is finance, so a pretty useless skill set. But so I don't really get the science. But one thing I do is I came to the conference a couple of years ago and just took a lot of notes, spoke to a lot of the clinicians, asked a lot of questions, so was really engaged and got it was a really profound experience for me, the conference in Texas. And also Sunitha's mum gave me a lot of words of encouragement. So she really is the MVP. So yeah, I got a lot from the conference last time. And for us at that stage, we'd just been diagnosed, so I really didn't know what was going on. And there are topics at the conference that I thought weren't really relevant for us, like hemiplegic migraines. And then 6 months when we got home, our daughter had a hemiplegic migraine. So it was just like incredibly, it was this incredible experience to learn everything, and then to have these contacts when I was back in Australia to reach out to the foundation and some of the folks in this room. And so since then, for us, it's all about paying it forward. So now ambassadors in Australia, there's families that are reaching out to us, asking for information. How do they navigate the healthcare system in our country? How do they receive funding? What sort of therapy should they do? So we just, and I'm doing this with my wife, Christina. We're just trying to help out as much as possible.
Great. I think a lot of you touched upon why you think it's important to get involved, but I wanted to kind of double click in terms of how has that impacted your journey? I know a lot of you talked about paying it forward or being, my mom basically forcing you to get involved, but why is it important for you as your individual experience? A lot of us don't have a breath to give, but why, how has that impacted your journey, I guess?
So for ours personally, we had been airlifted out with Emery she was almost 3, and we felt lost, completely lost. And sorry, I'm a crier, so I remember being in a hospital in the middle of the night and finding the info at cactus1a.org and emailing, and we were discharged with literally we had taken a helicopter to a bigger hospital, right? Because we're in a small town, and they put their hands up like this, and they're like, you have to go to a bigger city. We don't know what to do for you. So they basically triaged us and left, and we were like, wow, that doesn't give us any answers. So within a couple days, Lisa actually responded, gave me her cell phone number. I'm a chatty girl, so here we are an hour and a half later. She never told me to stop talking. She never said, quit asking me all these questions. And within the next 6 months, it genuinely changed our lives. We felt like we found a home, and it empowered me to ask questions, get her screened for therapies. I had no idea therapies would change your kid's life, So that personally just allowed us to find a space where, in the process of me finding this new home, like Sunitha says, it's a family you really don't want to be a part of, but you're like, welcome, here we are. We're going to take care of each other. So within those few months, I said, what can I do? Because I don't want other families feeling alone like this. And so we together kind of decided, let's facilitate a newly diagnosed group. So every 3 months, we do a Zoom call, and really all I do is facilitate, and they set up the Zoom link, and I hit hello, and whatever we can do to just try to help families. And then also, I didn't understand how expensive science is, and it was very defeating in the beginning. I'm like, how are we going to make an impact? So collectively, my husband has a business in New Mexico, and so we thought, you know what, let's use the platform that we have through our business, and also just encourage other businesses to say, hey, how about donate a raffle basket? How about give a gift card? Just anything we can do to try to start getting funding together. And then we joined with the 5K. I'll be completely honest, no one in our area wants to run or walk, actually. And so they were everyone's like, yeah, we'll pay the fee to join Emery's Encanto, but we don't really want to actually go and do anything. And I was like, well, that's not great. So coming from a big golfing community, we were like, you know what? No one wants to run, no one wants to walk. Even if we throw color or whatever. We can't get anyone motivated. So we decided, you know what, let's do a golf scramble. So I threw everyone on the 5K committee for a loop and was like, hey, I'm going to be a part of the 5K, and we're not doing a 5K. So you want to help me out? So thankful for the Dawleys for helping create the techie computer part behind it. And we did a registration form. We had an incredible event that I am super thankful. Our community supported us like crazy, and they had a lot better time at a golf scramble than they did at a 5K. So one thing to just encourage you guys, whether it's uncomfortable or not, step out of your comfort zone. Try to just realize that, just like y'all have all said, some of our kiddos don't have voices. Some people don't have that breath to be able to use to make a positive impact. And so I would just encourage anyone knowing you really can make a tremendous difference. All you got to do is just try. So.
And they raised $30,000.
I don't know if you heard that, but $30,000 raised. Yeah, so I think that there's a lot of feelings when you have a rare kiddo without a treatment of hopelessness. And I think that for me, a way to combat that is to do something. And so by doing something positive, it gives me a lot of feelings of hope. Like, it makes it feel not so senseless. It gives purpose to my life. So, and then I can really split my life into life before the foundation, because Gabby was diagnosed in 2015, and then life after the foundation. And I can remember the years of not having anybody to turn to and just feeling really alone. And so through the foundation, I just 2 years ago was starting to be connected with some of the other families that have the same mutation as Gabby. She's in the A713T group. And it's just been such a joy to be able to connect with those other moms and just to form this deep relationship, and dads. And it's actually like probably my best friends are those that I'm on WhatsApp with, and they're chatting all the time. And it's helped me because these other moms of younger kids are thinking through things that I didn't even think of myself. And so, you know, you could say that I'm trying to be a champion for them, but they're helping me figure out how to help Gabby. And so we're just collectively helping each other. And we're just really there for each other in a really deep level. And that has brought me a huge sense of community and purpose. And so I also would say I did the 5K 2 years ago and again this year, and I am like not really into like running things or doing 5Ks. And I would say I was shocked at how easy it was, number one, because the foundation does like the whole platform. Like I literally just had to like send people like QR codes or messages and be like, I did have to, actually I had to have a call with Carolyn, where is she? About, because I'm so bad, like, I don't actually know how to do what you want me to do online. So she just jumped on for 30 minutes and helped me set it up because I'm that bad. And so she was able to help me out. And I would say in that conversation, I was really shocked because I said, oh, well, there's like people that are supporting like sponsors. And I was like, that's amazing that you all are like getting sponsors. And she's like, yeah, no, that's just me like asking local businesses. And I was like, oh, like I don't really know local businesses. And she's like, yeah, I don't either. Like I just go ask, and like anyone can go ask. And I was like, oh, okay. And then I thought about it. I was like, oh, I actually have 3 brother-in-laws or brothers that have small companies, but they're the owners of their small business. I asked all 3 of them, and only one said yes, but one of them was the Paul the Plumber sponsor. And so I just realized like a simple question, and they'll ask. And when they get to do it, they like my brother got to sponsor something for Gabby, and that gave him purpose that he's helping out, and like he and his family were so happy to be able to be a sponsor. And so it's giving them the opportunity to also help.
So, like many of you, when we got our diagnosis, we were lost. We were handed a piece of paper. It was a study, and our geneticist, who was like the most famous geneticist at Nemours in Florida, said, I have no idea about this. Contact somebody at the top of a study. And we were like, we don't know how to do that. But my wife, through all of her research, found Josh Rotenberg's name on there and a Facebook group. And at that time, we had about 40 people in the group. And things started to connect. We met some awesome people that later started a foundation in there. And but that feeling of being lost and then getting that community, as Deb said, was just transformative. And what we are able to do is we now have that community, and we started to build on that and talk to people, and the foundation started. The joy we got from that, and as a community, and the consolidation of information, and we went from that area or that space to our conference back 2 years ago. And in that conference, we learned that our child, who was the most developmentally delayed in his school, is now at the, I'm going to call it the better end of the spectrum for symptoms in this community. So we learned that we are at where we are. Like we have our spot on the spectrum, which gives us our life experiences, and we learned that everybody else that came to the conference was in that same exact position. Some people's children had more severe symptoms, some had less severe symptoms, and we were all able to bond with that. I was watching the video with Rika talking, and just that bond we were able to get, like with Rika and others, is something that we have and something that we can continue to do as we're doing at this conference. We'll do at future conferences, and the gaps in between is creating that bond and helping other families on the emotional aspect, not just the research, fundraising, the awareness, and other things, but that emotional aspect to say that we all are on a shared journey. So we're on that shared journey with all of you, and we love the journey. There's a lot of scary parts in this journey. We share in the fear with your families when we see that people are going through harder times or anything else, but we also share in the joys and the smiles. We know each other's children. We know each other's siblings. We know each other's just families, and that brings us a true sense of purpose. That regardless of how Avery might be doing at any other time, you all are our family. So that is one thing I wanted to touch on. Another thing is to go on the fundraising. As Deb said, we just need people to go ask companies for money. We threw a lot of darts at the wall. Sonia and I went to 40 places or so and got 2 sponsorships, which were phenomenal. 38 didn't give anything, but we did a little bit of legwork, got some extra money there. We sent things to corporations, got nothing, but we tried for some and got some from some others. So to get more people involved and to be able to, if you are somebody who talks well to people, and you can go and just ask for something and be okay with that. We need more of that involved. It's a hard thing to do sometimes, but people want to give. Both people want to give. Businesses want to and need to give, tax write-offs and things. And that all goes toward our research. It's directly, we have very low overhead here in the foundation, which is a phenomenal thing to be able to tell people. And that it goes to research and does important things. And to see here at this conference and hearing all the researchers and clinicians talking about the progress we're making, and 2 years ago talking about just where we had gotten to that point in the foundation and the research and everything, to say that there is a path forward. There is a roadmap to a cure, a roadmap to treatments. We know what we need to do, even though some of the things are hard. And to be a part of that gives me and my wife just meaning in our life every day.
So I think I'm going to reiterate a lot of what you said. But yeah, just sort of in this role, it's given us a lot of meaning and purpose to help others. For us, it feels great to help other people. It feels great to help others that have just been diagnosed. They don't have the resources. They don't know which doctors to see, which schools to go to, what medication to take. There's sort of simple things that we're helping with. It really goes a long way when you can reach out to others who don't have the tools or resources or a framework to sort of deal with some of the issues that they're dealing with. And yeah, I think we're all in this together, and the connections I made from the last conference, like the Roths over there, like we text, we send WhatsApp messages of each other's kids. Both of our daughters are similar age, and yeah, we share in the ups and downs together. So yeah.
That was really powerful. Thank you all. Now that you've been at your second conference, what are some things you're taking home with you in terms of like, you want to continue, you want to add? Deb, you sort of touched on this with the neonatologist, but are there other ideas that you have either for you personally or us as a community that you'll be sort of leaving here with, that, and it's for anyone wants to chime in on that.
Maybe I'll just go first. So I know that this year there's more attendees from overseas. So I think there's families from Germany, from Canada, Italy, and then I think, Sunitha, you mentioned there's a fair few online also. So I think the international expansion is continuing at pace. And then we just need, we need families in these countries to sort of step up and do a similar role to what we're doing in Australia, just sort of act as an ambassador for your country and reach out to affected families where you are. I would say it's like we like my wife and I, we both have full-time jobs. It's obviously a full-time job just caring for your child with a rare disease. But it's not a full-time job to be an ambassador. You can sort of do it on the side. You do it when you can, because these families need us.
Yeah, I wanted to touch base on the Cure Club and just give a little background there, because I think that's what I'm going to focus on a lot in the future. So that developed because I came to this conference 2 years ago, and I was really hoping when I got here there'd be a checklist and someone to help me figure out what research I had done or had not done or had forgotten to finish or just something. And I was shocked that there was nothing to help me. And I think because Sunitha and Lisa don't need that help, they're really smart and they just are have a system and they don't understand people who don't have systems. So this is mostly for any of you who are more like me and don't have systems. And so I am kind of an idea person and not really good at finishing tasks also. So I was like, it'd be really cool if we had a checklist this year, blah, blah, blah. Then Gabby had a really rough couple months. And this is an example of our community. I felt like I was really letting you guys down because I had an idea, but I just couldn't finish it. Sorry, Gabby had she was really bad. It was a couple months of just no breath. So Shanna took it on. Shanna, who's not here, couldn't make it because they're also having a rough couple months, but she had a breath. And she designed the Cure Club. She came up with a cool name. I'm not creative. She came up with a logo. It would have been black and white if it was me who wrote it. So thank goodness Shanna took it over. And she just made the checklist. She brought to light what my idea was. And so that's an example of, I saw a problem that I think needed a solution. And the problem is that there's two things our community needs: money and numbers. We need people to actually fill out the form so that we have enough numbers that drug companies will look at us and say, we want to work with your community. And so, there's ways that we can work on raising money, but how do we get the numbers up? And I just was trying to brainstorm that's a problem. What can we do? Well, what if it's someone like me who wants to do it, but it is scattered? And so we just designed this club. So just to give you the overview, the club is a 1-minute QR code. It's out at the table that you take 1 minute and say, how can we help you? Do you like text messages? Do you like emails? Do you want us to send something in the mail? How can we assist you in whatever way that you feel like you need assistance? Or do you want to reach out to us and know that you're not good with computers like me and you started the survey and then you got confused and you don't understand the consent and we're just there. Sorry, I probably said all this yesterday too, but the other part of the Cure Club, though, the second part that I would ask for help, if any of this resonates with any of you, is that I think it works best in community, small groups. And so there's about 10 of us in the A713T community, and I'm the person that kind of is talking with them and being like, hey, did you fill out this survey? Hey, did you do this research? Because I want our patients represented. And so they're, filling out surveys and doing research, but I'd love to break it out into either variants, where there's the PED person for that variant, or location. So Chris would be in charge of Australia. I think we've just found somebody for Canada, and they would be that person that then is the point person to help any families that need any assistance completing research.
I love that idea.
I love that idea, Deb. So moving out of here, I am hoping, so I met a wonderful person via Zoom and now in person that's new to the organization. Lynn, hello back there. And I want to start seeing what I can do to help her with outreach and other abstract ways of fundraising. We do our 5K. Some of you may not be aware, but we also, the foundation last year participated in a thing called the $1 Million Bike Ride in Philadelphia, hosted by the Orphan Disease Center. We raised a lot of money last last year and this year. So thank you to Lisa for participating, and everybody else who has participated, raised funds, or anything of that. But that comes on our heels for our 5K, so it's a harder fundraiser. But there are other fundraising methods out there. One of them that I'm looking at is a combined federal campaign with government agencies, and I want to see what we can do that puts less effort on we as a community and can kind of get us in the door to other larger fundraising efforts. So that's one of the things that I want to do, is do that after leaving here, because I find it that we need more money. Because if anybody knows a billionaire that wants to just give us money too, just please raise your hand. Nobody? Oh, man.
I just think I feel more empowered to use my voice. I tend to shy away, especially having a youngest kid with like IEPs, for instance. They're really uncomfortable. It's hard to advocate. But in our community, genetic testing is just, for some reason, kind of like a stigma. So I feel empowered to just use my voice more and be a little bit more proactive in getting the word out, whether it's advocating for families, whether it's advocating for fundraising, just being creative. So if there is anyone that has fundraising ideas or anything y'all want to bounce stuff around, like I said, I like to talk, so y'all are more than welcome to reach out at any point to where I could try to help you guys be more successful, but I just want to be more, I want to do more. So.
Thank you.
I'd like to piggyback on something that Sarah said. She talked about talking about genetic testing in your neighborhoods. We know that a lot of people are just diagnosed without genetic testing with cerebral palsy, just seizure disorder, all kinds of generic things. So if you have other people in your community that you talk to, push for them to get their doctors to get genetic testing, because it's not only our community that needs more numbers. Maybe they might not have CAC1A, but there are other genetic disorders that weren't previously diagnosed, and it can only be diagnosed through genetic testing. So have these conversations with other families that are in similar shoes as you, and push for them to get their doctors, get their loved ones genetic tested, because diagnoses is the key to our numbers and everybody else's numbers, and getting those people help, not just for us, but obviously for the individuals. They can get more help by knowing what they actually have instead of a generic diagnosis.
I'm going to try really hard not to get on that soapbox, but that is like my jam. So cerebral palsy, epilepsy, global developmental delay, or intellectual disability are all like clearly need to get whole exome sequencing. And also there's a lot of misconception that someone might say they had genetic testing, but that might have been like a panel or microarray. And so it really needs to be whole exome. And my email is like really easy to find. I'm on Instagram. No, I'm not on Instagram. I'm on LinkedIn and Facebook. So just if anybody ever has any questions about genetic testing, I would love to talk to them.
We're going to wrap up this session, but any closing thoughts in terms of things we haven't covered, parting words for this group here in the room and virtually? Anything that you wanted to touch on?
So if anybody's scared to be involved, you can talk to us. We are the ultimate scared people who say yes even though we're scared. So if you want to learn how to say yes even though you're terrified to do something new, talk to my wife and I. We live that experience, and we know it can be hard, but just ask, say yes, be uncomfortable, do as good as you can, even if it's not a great job. Every little bit helps.
Yeah, and I would just say every one of us is powerful because we have a really unique story. And there's a lot of doctors and researchers who are very empowered by hearing that story. And so you don't have to be a pediatrician. You don't have to be a geneticist. You don't have to be a researcher. Actually, us sharing their story is really impactful. And so on Thursday, I was able to share my story with the researchers, and so many of them came up to me and said wow, sometimes I'm in a lab for years and we never hear the patient's story. And so I think just any avenue you have to share your story can be really, really impactful. And so your journey, your story is impactful, and that's it. You don't need anything else. That's already so impactful.
Yeah, I would just reiterate that. Somebody in Australia found us on the website with the CAC1A champions. Our daughter's on there, just sharing that story. They found us because their daughter is also called Elise and lives in Australia, and they somehow found us. So That was amazing, and we've shared our story with our neurologist, who then puts it in a magazine and goes out to all the families, and so sharing your story is incredibly impactful. And the other lesson I probably took is it feels like a bit of a marathon, not a sprint. I think last time I came in and I was taking all these notes. I was like, okay, we're going to get to a cure really quickly. Obviously, this stuff takes time. The science takes time. We need more numbers. We need more money. It's a recurring theme. But I think it's really important for us to be there for each other. I don't want to wait 2 years to see everyone again, but given we're on the other side of the world, is just staying in touch, calling each other, messages, etc., to have each other's backs.
Sarah, do you want to say it? That's, I think, a perfect note to end on. I don't know if everyone in this room is on the WhatsApp group that we started for this conference, but if you're not, you should join. And I think that's one really easy way to stay in touch, but we obviously have other ways. I think the Facebook group is really big, so I don't know if everyone's comfortable speaking in that forum, but we're always here to connect families with one another. We hear from families every week that they're newly diagnosed. Is there anyone else with our variant? Is there anyone else who lives near us? There's another thing I think that wasn't totally raised today, but the 5K, we can start doing 5Ks in local areas combined together. We don't all have to each do our individual 5K. And so thinking about ways to collaborate and meet each other locally. I think Teresa, I don't know if she's in the room. Teresa's done, I don't know if you want to just briefly touch on what you've done in Texas to organize the community there.
So I decided Texas is a big state, and there's a lot of us there. And by a lot, I mean like 10, that they knew about. So I started a Texas group, and we meet every other month or so on Zoom. And then my husband's a runner, so he really likes the 5K. And so we invited all the other Texas families to come and do the 5K with us. And we do it in our neighborhood, and we have a neighborhood swimming pool. So we do the 5K, the kids all get to swim, and then all of the CAC-1A families come to our house and have lunch and get to hang out together, which is great because we get to share what doctors are in Texas, or who do we see, and what neurologists, and oh, you might want to try this eye doctor. And then the last conference I was here, I met a lot of grandparents and sisters and uncles and aunts who came to support their families. So I asked Lisa and Sunitha if I could start an extended family group. So we've been meeting for about 18 months now, and that's one of the breakout groups. So if you're an extended family member, come to my meeting this afternoon. Shameless plug.
Thank you. So we have a few minutes. Does anyone in the room have questions for the panelists? Here, the mic.
Yes, my name is Rick Monk. I live in Harrisburg, PA, and I'm associated with Dr. Helbig down in Children's Hospital. But we tried to get sequencing done through a local doctor, and it was continually disapproved by insurance companies, that they either didn't write the justification up properly or whatever. As soon as we went to Children's and talked to Lana down there, it was approved. So it may be that there's issues with that when you get into smaller or other insurance companies that won't do the exon sequencing for you.
Yeah, that's just like a whole huge topic in terms of like insurance coverage, but it's really fun to watch how that's really changing rapidly. So at this point, I think there's 35 states or so that it is covered for Medicaid, covers whole exome sequencing, but there are rules in each state as to like who can order and if it'll get approved and exactly how to do it. So there's a big on-ramp of training. So I went through as a general pediatrician that personalized, like I just trained myself and I figured out how to write it in a way that insurance would approve it. And so I am ordering whole exome myself, but that's probably like maybe 2 general pediatricians in the country, and I just do it because I think it's really fun, because I'm a nerd, like I guess like some of these other researchers are talking. But I also did it because I was frustrated that even geneticists are not always ordering the correct test, and it's really frustrating to me. And so I would send to Boston Children's, and the children would get like 10-year-old testing like microarray. And so I think it's another huge topic is that we just need to really educate families that they might think they got genetic testing, but all genetic testing is not equal. But it's changing, like insurance is starting to cover more and more. And so I think we're getting to a point where it's more available and covered and less expensive. But then I have to do the piece of like training physicians, like all of them, that that this has changed and it is an affordable test, and that's just really hard. So the science is changing a lot faster than the medicine, and to change like an entire culture of medicine is really hard. So a lot of doctors assume it's not covered by insurance, even though people are fighting with legislators to get it covered. And at this point, it's exciting that it is, but now we need the doctors to order it and parents to advocate.
Here, Lisa has a mic, needs a mic.
I was just going to say on that topic, one of the large genetic testing companies, Invitae, had a program called Behind the Seizure. And if you had a child who had their first seizure, an unprovoked seizure under the age of 8, they would do whole exome sequencing for free. And Invitae has disbanded as a company, but GeneDx, which is the largest genetic testing company in the world, I believe, they've picked it up. And so, again, that goes back to advocating for yourself.
But Lisa,
it does exist.
It's super exciting because it used to be under 8 and it was only an only an epilepsy panel. And now it's through age 18 and it's whole exome. So I'm like really excited. That's new as of July this year. I know, just like. Sorry, yeah. So in the past, the program was called Behind the Seizure, and it was a nationally funded program where any child under 8 with epilepsy could get free genetic testing. The genetic testing was an epilepsy panel, which means it's looking at 200 to 400 genes. If you think about that, they're going to decide a genetic panel, like an epilepsy panel, and then over like 2 to 4 years, like roll it out. And so anything that's new over 2 to 4 years does not get added to that panel. So the second the panel's live and ready to go, it's outdated. So they're doing outdated epilepsy panel. Yeah, maybe it's going to pick up those 200 genes, but nothing else. And now it's not within Invitae anymore, and now it's GeneDx, and it is now extended in age. I believe it's through age 18, anybody with epilepsy. And it is not the panel, it's the whole exome. So this is like a game changer. I think there is a little hiccup right now, at least in my opinion, on like exactly how this new program functions. But I think people are gonna get up to date pretty soon.
Sorry, I just thought it was important.
Yes, yeah.
Yep, question.
Hi, my name is Shauna. So my daughter is 33 years old, and we just had the epilepsy panel testing done, which verified the CACNA1A. And the first testing we had was in 2016, and that was the S&P. How do we find out what states actually are approved for the genome testing?
Yeah, so I would just recommend you go to GeneDx, and they usually have really nice like maps where they say like state coverage of Medicaid for whole exome. There are unfortunately some, it's never easy, guys, I'm really sorry, but like they'll cover whole exome if it's your first genetic test. If you've already had a microarray or panel, they might not cover it. So that's also why I think we just need to start with whole exome, because it's the better test and it'll be covered, and not do these subpar old tests that then mess with insurance coverage. I can talk to you offline though and see what I can help you with.
All right, thank you.
Any online questions? Anyone else in the room? Comments? Yeah, Rika.
Sorry. I don't know if you guys mentioned it because I was a little late, but I just want to throw out there for all the new families that are here that didn't come to the last conference, don't get lost in comparing. That's what I did. I came with the mindset of a cure, obviously, and looking at other kids to see what mine could possibly do. And that was the worst thing I think I've ever done. So, and I say that because we have the two functions, you know, the loss of function, gain of function, and even having that specific part of the variant, he's still so different. So I found comfort in seeing the family's strength in general. That to me was more than comparing Ruben. So don't compare. Don't worry about what your kid may or may not do, and just keep pushing, because in reality, for me, the best thing from the conference was just seeing that we're all doing the same thing.
I think that's a great point to end on. Thank you for saying that. Thank you guys so much. Thank you.